Hello, everyone. I'm Bob Brocker, founder and president of AgeWise Colorado. As you can see on our website home screen, if you take a look at that, agewisecolorado.org, and we appreciate the fact that Home Helpers Denver is a patron sponsor of AgeWise Colorado. And Home Helpers owner, Rick Cseak, is a good friend of several nonprofit organizations in Colorado dedicated to helping the people of Colorado to age well and age wisely. Rick is also a certified senior advisor and certified dementia practitioner. As the oldest child in his family, Rick was blessed to have spent many of his early years around all four of his grandparents. He loved being around his grandparents, hearing their stories, their history, and many of you have as well, with your own grandparents, of course, not Rick's. That time has also helped shape Rick's avocation, and he does love what he does for spending the last 27 years helping people to age in their homes. Home Helpers of Metro Denver is not only a valuable service, bringing one-to-one care to our seniors, individuals suffering from, or not suffering, recovering from surgery and rehabilitation, and others with continuing care needs, but also uh, he's also a leading employer of some amazing women and men who truly make a difference in the lives of the many people that they touch every day. In-home care allows Rick and his team the opportunity to be active contributors in communities and homes throughout the Denver metropolitan area. Since opening the Denver office in 2009, Rick has come to understand that all of us will need a little help at some point in our lives. Making life a little easier and making a difference in someone's day is a privilege that Rick and his team never take for granted. And now I'm going to turn this over to Rick.
What enhanced that in the year 1996, I started working with seniors. My grandparents, I was the oldest, I was around them. So the initial, when I started in home care, I just had the heart for it. I wanted to make a difference. Very passionate. What's kept me in it has been, and probably some of the questions we might get today, we are in an industry and a population, an age population that's changing every minute. And what's grown. I think I gave Bob the stats. We've grown 15 million seniors in America in 25 years. Well, guess what? That same number increase is going to happen in the next 5. So I think what's kept me in it is I want to be part of this change. I'm going to be my own. I'm going to be my own client in a few years, and that's how long I've done this. So that's what's kept me in it. The passion. Also, I've met some wonderfully talented people. Bob Brocker, we are friends also. I was on a couple of different boards early on. As I got busy with work, I had to back away, and I brought Bob in, and now Bob's turned into this. Always was, but he's a true leader in the senior revolution. What's happening? So I think that's why I'm still in it. I'm working with people like Bob, other folks in Denver, statewide, nationally. And also, I'm meeting a lot of young people in their 30s that are going into home care. And I feel like I'm having a wonderful opportunity to mentor with them. So that's what's kept me in it.
Yeah, yeah, Rick's responsible for me getting into this whole aging area in the first place, 16 years ago. But the other thing I would add too on the demographic note is here in Colorado, between 2020 and 2030, our 65 plus population is growing 40%.
Yes.
Um, that's a huge, huge number. And so by 2030, we'll have about 1.2 million people over the age of 65 just here in our state.
Yeah.
Um, so that's going to be over 20% of our population. So it's big numbers. So
And that's mimicking other states. Yeah, Bob, yeah, that's a great stat. The big change in the year 2000 when I kind of started with home care. There was the first of the baby boomers coming in, and that's the years 1946 to 1964. The care model was very different. It was about folks in, I hate to say institutions, but nursing homes. It was more facility based. Even the workers. So the big change in 25 years is, if I ask the family now, most seniors, most families are going to say, mom and dad want to stay home. So now the influence is more towards growth at home, staying at home, home care that comes into the home, healthcare that comes in the home. You're probably hearing more about telehealth. There's so many advances happening, all the way up to the word robotics. I mean, we're hearing a lot about technology. So those are some of the embraces or changes that we've embraced in 25 years. So as Bob said, the next 4 years, Bob, it's already 2026. We're going to grow to this huge population, and probably again some questions you might have as our aging population is growing. Our has been shrinking. So, that as an employer, we want to retain caregivers. We want to do everything to help. If a family chooses to keep a loved one at home, we want to help them stay at home. So that crosses into a lot of other issues. As you know, Medicare is medical oriented, kind of medical services is what I share with folks. Home care is based mostly on private pay, long-term care insurance. I am doing a lot more if it comes up today with veteran assistance. And we still have Medicaid. Colorado's fairly strong, what's called our home-based waiver program. So love to chat with you a little bit about that also today. Bob, I guess if you and Barb are on, if you see questions come up in the chat room, feel free to throw them at us and we'll chat about it.
Well, we'll do that, but and do feel free to throw your questions in the chat. But I have a couple before we move on here. So you mentioned Medicaid for one thing. So tell us more about how Medicaid helps with in-home care. Um,
Okay, well, Medicaid is first off, it's federally and state funded. So it's a program that changes state by state. And I know you've all heard about Medicaid cuts. So right now, the Medicare doesn't really cover in home care. It does cover services like PT, OT, speech. You can get into some hospice, those kind of healthcare services. Medicaid, though, has been able to tap in with the waiver on helping out with some home care needs. So Medicaid is going to be usually for lower income, but what we're seeing with the baby boomers, and you probably have heard about the spend down, we're seeing more folks open to the idea of looking at Medicaid. And now, hand in hand, we don't know where the cuts are going to go or if that's going to become a better option here in Colorado. If folks do take part in the Medicaid program, in-home care can be a solution for bringing in long-term in-home care. We are not on the Medicaid waiver right now here in Denver because, quite frankly, the problem for an employer, I'm paying my caregivers more than the reimbursement is to do the program. So we're trying to look at some options though. I'm involved with some folks that are doing some state legislation, and I hope in Colorado some changes come up with that, Bob.
and then as far as the veterans side of this, I think there are, I've learned this over the years that a lot of families of veterans are not aware of services that can be provided to
Yeah.
their families. And I think in-home care is probably one of those.
Yes, sir.
Accurate.
You are accurate. I'm a veteran. I'm a third generation veteran myself, and I go to the VA. So I had not been told about these services. I think they keep them quiet. Maybe it's financial budgeting, but let me tell you what's out there. We work with two of the programs. One that you've probably heard about. I know, Barbara, you have aid and attendance. That's usually for folks that maybe maybe lower income. The higher your income, the lower hours you're going to get. It's a program you have to apply for, and my understanding, it's a lot of paperwork. So families will call, and I'll direct them to folks that might help them. Once you qualify, that funding, let's say you qualify for $1,500 a month, that money is sent to the recipient, to the veteran, and they use it for home care. But what I have heard, the story I'm hearing more and more, what might be even above home care is food, eating, prescriptions. So we're in that line. Folks have used it. The program we're working with the most right now, and it's not dependable. It's not. It doesn't depend on your financial. If you're going to the hospital, to the Veterans Hospital, a clinic, you're in the system. Care coordination or care coordination community. Care coordination, if they go visit the doctor and they say they need help with ADLs, activities of daily living, personal care, they will write up a script and that'll get turned in, goes up the chain or down the chain to a care manager. I will get a letter or a note saying we've got a veteran, or there can even be respite services that needs care. They have been qualified for 16, 20 hours a week. So that, if you get with an agency that's got the community care veterans contract, there's a lot of possibilities. I would tell you probably half of the clients I talk to are veterans. So it has to be a veteran that is going to the hospital. I don't even think they would had to have served during wartime. It would be any time in their lifetime. So keep that in mind, because in Colorado especially, we have a huge veteran community.
Yeah, we certainly do. So yeah, the other thing you mentioned, the private pay. So outside of that program you just mentioned for veterans, and Medicaid is kind of out at the moment, at least for in-home care. So that leaves that leaves private pay because Medicare does not cover in-home care, which I think a lot of people have a misunderstanding about that, that Medicare does pay, but they don't. Um,
I was one of those.
yeah, yeah, yes. Um, and so uh, tell us a little bit about long-term care insurance, and how many of your clients that have actually have long-term care insurance,
It's
roughly?
another great question, because for the most part, it is private pay. Right now, my clients, about 20% of my clients have long term care insurance. So that can also assist with assisted living, independent living communities, just so you know. So back in 2000, I might have had two clients, three clients that had long term care insurance. It's growing, I think, because the needs growing, and I think folks have been educated about long-term care insurance. So about 20% is based on activities of daily living. So those are what you might hear as ADLs, and it's going to be your personal care. It's going to be bathing, help with transferring, safety, repositioning. Just anything that's personal care, can be feeding. A large number of our clients now need help with two or more of those needs. So what we will do, and what long-term care insurance will cover, we will meet with the family. We will act as a liaison and contact the insurance company, and 9 out of 10 times they qualify. So if you're dealing with families or clients that have long-term care insurance, it's something to work with. I think the quote for that were probably, because this group of baby boomers coming in now, many of them have bought long-term care insurance. So I believe we're going to see that go up to 30-35% of our clientele.
And for the younger people on this call today, and those who know younger people,
Yeah.
tell them about long-term care insurance. The younger you are, the less it's going to cost,
Yes.
per year at least, anyway.
So I'm 65 soon. I have not purchased it. I have friends on this call probably that have. So Bob's right. The younger you are, two things: your premiums are going to be less, and they're going to look at if you have one of the top five health issues. Heart disease, COPD, dementia. So typically a younger person doesn't have that, so you're probably going to qualify. I actually have a friend that just got their policy, and they're 49, and their premiums came in at three something a month. That's still a lot of money, but I'll give you a verse on that. I know someone that's 70, 72 that recently got it. Their premiums are quite a bit more. They were still healthy, but I think their premiums fell in the more, $700-800 a month. And so it's Bob. A lot of times it's budgeting for that. Shop your policy. Make sure I'm going to tell you most families need that 20 to 40 hours a week. I've seen policies where they're written up where they get 1 day a week. And maybe it's that they have to be on with an agency or living at a community for 80, 90 days first before they qualify for the benefit. So it's something, and you're anyone that wants to ever call me and talk shop about long-term care insurance, it's changing quickly too. Some of the older companies that did long-term care insurance, they're not offering it now, and you're seeing kind of a new group come in that they are offering it. So
So who are the ones that you can think of, Rick, that offer it today? Insurance.
right away, the companies that I'm working with: Transamerica, Genworth. Um, my mom and dad had them. I have a policy, a different type of policy with John Hancock. CNA. They're based out of California. They bought out a bunch of long term care insurance companies over the last 10 years. So trying to think. Those are probably the top three or four that I'm working with right now. But
Yeah.
if you get on, Genworth actually has a great website, and you'll see a lot of statistics, and they will mention other long term care insurance companies also.
Yeah. Okay. Well, we have, just to recap, CNA, Hancock, Genworth, Nationwide. I think New
Mhm.
York Life.
Yeah, New York Life is still offering it.
Yeah, and maybe Prudential. I'm not sure about them. And then there's one other one I can't think of right now. But
There's a new TV show. Oh, it's coming on. I think in March. It's a TV series called Aging Untold, and I believe one of the first things I heard they're going to talk about, questions that seniors want to know in families, is about long term care insurance. So you might want to make a note. It's called Aging Untold. I cannot tell you which network, but I know it's starting within the next 30 days.
well, that's good to know. Thank you. Yeah. Well, and somebody asked a question about age. Well, I have long-term care insurance, which I took out probably when I was about 67 or 68, somewhere in there. So,
Right.
it's not too late. I mean, it's just going to cost more, but you have to weigh that against the cost of care later. So,
I've actually had a couple of clients that started services, applied for long term care insurance, and they were in their late 70s and they got it.
mhm.
So then the next call I got, they said, "Oh, Rick, my mom and dad are going to be on I love it when they say 20 days and they call it, oh my gosh, I'm blanking. I'll come back to that. But at 20 days is good. When it's 100 days, I hate to see that. But they've actually been able to be with us. And actually, one of them lives in an assisted living facility. And after they went through that period, they were able to use some of that money to pay for their monthly rent at the facility. So
So you talk to a lot of folks, and some older adults, obviously, but also their kids. Um, and so, what are the things that come up the most, in those conversations, and when they're thinking about, hey, we might want to provide some help. So,
their focus, and I love you brought that up, Bob, because I think more than any time in history, we're talking to the kids. We used
Mhm.
to call it the sandwich generation. They were raising their kids and they had mom and dad. Now, a lot of them, their kids already in college, out of the house. They're working with their mom and dads. And the questions they ask now, there's a lot of honor, a lot of care about their loved ones. They're looking at the total my health picture of their mom and dad. They're looking at the relationships they want. When a company comes in, they don't want to have 15 people coming through the house. They want to have a staff of one or two people that are taking care of them. But a lot of it, Bob, I think it's honor. It's they want to keep their mom and dad or their loved one with peace of mind, that we honor the purpose of that person. um, they're talking about dignity. They're talking about how we work with healthcare and how we can be. Bob and I've used this phrase: "It takes a village." So those are what the kids are asking, and they're vetting companies. They know that there's a large turnover with caregivers, whether you're at a community or home care. So they want to know how your company's managed and who you surround yourself with.
And I'm sure money comes up occasionally. Yeah.
Money comes up all the time. So, that I was going to go on that a little earlier, here in Denver, and I know I have folks from all over Colorado. You're probably going to hear home care rates between 35 and 48 bucks an hour, and communities. What I'm hearing now throughout Colorado for care for a loved one at an assisted living or independent, anywhere from 5, 6, 7, upwards to $12,000 a month. And a lot of times that higher numbers when there might be cognitive care needed. So we're always looking at, we have our staff, so it's always a balancing of keeping our prices as valuable as we can for a family and paying our staff that do this wonderful hard work. Here in Denver, I think most of the agencies in the metro area that they're around that $44 an hour mark. So we're with families, when I'm talking to them, Bob, going back to that, it's usually a pie, and there's 4 or 5 pieces, maybe 8 pieces, and a lot of times it's long-term care insurance, private pay. Families might be looking at assets that mom and dad have, siblings. I had a family come on a couple of weeks ago. The 4 sisters are each contributing to mom's health care or home care, which I thought was really beautiful. It may be volunteerism. Bob's been involved with an organization I was involved in, the Village Movement. That started in Boston in, gosh, the late 1900s. We're blessed here in Colorado. We have a company, I guess I can mention them, A Little Help. It is amazing, and they're not only here in Denver, but they're throughout the state and other communities. They work with volunteers, so we might talk about that with the family. A lot of times I'm asking them, how much are you involved? Because right now, besides home care agencies, growth with home care, the next biggest group I'm hearing a lot about are family caregivers. So I'm stepping in, helping with mom, or it might be even friends and neighbors. So those are kind of the pieces of the pie I'm hearing about, Bob,
Okay.
most
Thank you.
often.
So, can you talk a little bit too about I often hear these terms, the difference between what they call skilled and unskilled, in home. I hate that term unskilled, but anyway, that's commonly used. So, can you talk
I
about
do
that?
too, and you might hear medical or non-medical, so it kind of goes hand in hand. Um,
Hmm.
so back in 1994, there was not a word for non-skilled or non-medical. Matter of fact, one of the first, it wasn't my agency, but another national agency termed, kind of coined the phrase non-medical. Kind of plays into non-skilled. So the way insurance. Long-term care insurance, private pay, they look at that. Skill's going to be anything that's managed healthcare, typically with Medicare. It might be from a nurse or a physician, uh, physical therapy, occupational therapy, speech therapy. Those are all considered skilled care. Non-skilled are what home care has been classified in, and assisted living communities. They're hiring caregivers that are trained. By the way, they are skilled. They get better training, probably, that's a little more intimate and very centered around the TLC care of that client. So, but unskilled and non-medical often is not covered in the medical skilled community. It isn't. So what we do, what a lot of agents are doing to bring in kind of that skilled non-medical, is we train our caregivers to be personal care attendants. Communities are doing that too. And so with that, especially with long-term care insurance, VA, Medicaid, sometimes those folks they'll fall in the insurance diagram, Bob. So there might be some compensation for the family.
Well, things like palliative and hospice care could be covered by Medicare.
It is covered. And Colorado, we're blessed. We have probably 200 agencies statewide. Right here in the Denver metro area, we have 30 hospice. Nowadays, they call them home health and hospice. So a lot of times what we're seeing, because we're focusing on care coming into the home, we can get a client to start with home health. They might be coming out of a hospital stay or rehab, and Medicare will cover physical therapy also at home. Um, Often that might lead to the palliative. It's covered by a lot of hospices. I love it because it might be that the nurse comes out once a month to check on mom and dad. It also starts a conversation because hospice care, we're going to go back into the 1900s. I think a lot of folks, it was short term. It was very, very much at the end stage of life. What I have noticed now, home health and hospice companies, they bring them in with the home health. As they go into hospice and they qualify, they might get 6 months. And that's where you get that next layer. It might be a nurse visit once a week, twice a week. Even a certified nurse's assistant might come in and help a loved one with a bath, or even sometimes it goes into non-medical, maybe helping out with a meal. So
But as long as there's the word nurse in there, then I guess Medicare is paying something.
that's it. If there's
Yeah.
a nurse or the doctor.
Yeah. Okay.
Exactly.
Otherwise, no.
Yeah.
Yeah.
My
And
great hope is that as our generation grows, that Medicare addresses that. We've got to be a voice, with our politicians, really. But what wouldn't it be wonderful if Medicare covered 10 hours of home care a month or a week? I don't know if we're ever going to see that, but that's my greatest hope in life.
it
Um,
doesn't look too promising.
yeah.
There's a question here. Did you say 200 agencies in the Denver metro area, or was that Colorado?
That's Colorado, and there may be more. The old where it just said hospice is changing. Here in Denver, we have 30 that I know of, and they're home health and hospice. So they will come in as someone's. What I've noticed with us when we get a referral, someone's discharging from a hospital to rehab, and that's usually when they are introduced to a home health hospice agency. What they'll do is as they go home from rehab to home, the hospice home health company brings in that next layer of in-home PT, OT, and speech, and that leads into the additional Medicare services that hospice has to offer if it's appropriate.
Okay. And please describe for everybody, your what your service would actually provide to a person, in your
So,
home.
so our goal is to, the number one thing I hear folks, not just 65, the biggest age group growing right now are 85 to 100. So I talk to a lot of those clients. Many of our clients are 85, 95, and what they want to stay home. So when we get that phone call, we will put together a care plan. We ask 3 visits a week so we can put a really good plan together that's not a band-aid. We want them to have success and happy with the care they're getting at home. So we'll go in and create a care plan. We do all the way up to live-in care. But as we're creating that plan, we're also talking about financial, because I think My dad said this once, even though he retired fairly well, he said, I'm still on a budget. So we want to address that with the family. And then it's caregiver matching. It's bringing in somebody that they're going to love. We have a care services director. So Tim will go in and meet with the family. It's really important to tie a really good match of the person coming into your loved one's home. Usually that process takes a couple of days. And what I'm seeing, we're keeping more folks in home care that aren't moving to communities. I kind of always have thought of in home care as assisted living with a twist. The twist is we're doing the assistance at home versus them moving from their home. So
Mhm.
that's in a nutshell, that's how it looks. I'm a working owner that doesn't golf. So I love working with my management team. And there are great companies out there. I'm glad we're amongst a list of some wonderful agencies here in Colorado that are truly trying to make a difference, help people stay independent, stay healthy, stay at home. So.
What percentage of the agencies would you say provide medical versus non-medical?
Um, Used to be more of them, but that has shrunk. I think folks are realizing let's do what we do well and keep it. Right off the top here in Denver and actually throughout Colorado, there are, especially in the rural areas, I think there are agencies doing both. But I would say right now here in Denver that are truly doing medical and non-medical companionship or home care and home, probably about 10 of them. And so we're licensed two different ways in Colorado: medical or non-medical. I'm going to go back to that unskilled that Bob said. So right now, like two of the ones that I refer a lot that do medical, Bright Star and Right at Home, you probably heard of them. I think they're still trying to do a layer of the medical, and a lot of times it's just medications, setting them up, or having that nurse come once a month to visit mom and dad. So that's what I see a lot of.
Okay, thank you.
You're
Uh,
welcome.
we have a note here from our friendly CPA, Rick, another Rick,
Oh
saying
boy.
long-term care premiums could become tax deductible on your Colorado state return. Out-of-pocket expenses for long-term care could be tax deductible before your benefits kick in. So before you pay upfront costs, you should ask when you will pull the funds. Uh, yeah.
Yeah, that Rick, that's true. And the last 3 years, I just had one this morning. Families are asking me for their full year financial statements with us for services, and they are turning those into their CPAs. That is an area I do think we're going to see some movement for the positive for seniors. That there's a write off, that there's a reimbursement, or however that works. And I have heard positive. I know. Bob, you might have to help me. I know there in Colorado, there's some state legislation really pushing that also.
I'm not aware of that, but that's good to know.
Yeah.
Yeah. Okay. Okay. What do you see? I mean, you mentioned technology earlier, so let's talk about that for just a minute. Wh-
Uh,
what kind of technology is being deployed today, and what do you see happening in the next couple of years?
I think that we have an innovation council at Home Helpers National. Right now, I'd say the biggest change has been telehealth. It's something that keeps the client home. Family members can be there. On the medical system, it's cheaper, and so I telehealth is probably in the number one slot. I think the next 2 years we're going to hear a lot more about in-home telehealth, and whether it's medical or non-medical. AI monitoring folks at home, safety, fall risk detectors. Bob and I have actually been involved in a couple of pilot groups that are doing those kinds of things. And probably on the far end of it, and a year ago, I would have told you it's 30, 40, 50 years away, robotics. And we're actually going to see that. That's a technical thing that's going to happen that it's not going to be 30, 40 years. We're probably going to see great advancement in the next probably 5, 6 years here. So I'm old school. I'm kind of an old fashioned kind of guy, but guess what? I'm embracing AI. It's a great tool. A lot of my families are checking out services. They're things that you're professionals about. They're vetting things we tell them. So they're going into AI. What is it? Chat GPT. That's becoming huge now. So you can go in. I had a tax thing that came up years ago, and so the other day I thought I'm going to experiment with it. So I put it in, and what came out, I couldn't believe it. So I would tell y'all, if you're technically challenged like I've been, or AI challenge, try to embrace it. But those Bob, those are probably four of the key areas I think we're going to see great advancement in the next quick time here. I mean, 5 years we're going to grow 15 million seniors in America. So they are pushing it right now. I mean, we're in a crisis. I don't know if it was you, Bob, that they're calling this the silver tsunami. It was Bob, and Bob made a comment that I'll remember. Tsunami usually a week or two ahead of time. It's coming, um, but so I don't know, silver tsunami. We've known this has been coming for a decade, 2 decades, since the baby boomers. So I think right now, where this industry changes and heads the next 5 years, we're all going to be part of it. And I think we're going to be ready for it. I think, Bob, you had a question for me. Are we going to be ready? And I said, I'm very optimistic. I think the biggest challenge we're going to have is probably workforce, enough people to take care of us.
Yeah, and that's where the robotics is probably going to come in
Yeah.
at some point. Yeah,
There's a gentleman. Do y'all remember the show? Oh gosh, was it Lost in Space? And there was Hazel the robot. And so anyway, we were talking, and their program's going to be. I guess I can go shout out. Somebody can take a phone and point it towards a pantry or refrigerator, and it'll put together a meal of what's there. And I think it's remarkable, and I think it's going to be huge. And anyway, the program is going to be called Rosie, and those are the kinds of things I think we're going to start seeing. And that village, maybe that could be part of it. How does somebody that can't afford to go spend $100 that week on food put together a healthy meal? So that's part of the changes coming up.
yeah, it's pretty may you live in interesting times. Well, we certainly are.
We do, we do.
Um, the the other one I would mention is the companion robot. So there was a front page spread in the New York Times Sunday
Right.
edition, like last week, I think, about this one called EleQ, which is one of the providers that's listed on our website. And this thing sits on a table, and but it's intelligent in some fashion. So, people can have a conversation, with it. Um, so providing companionship which is a really big deal for, as you well know, Rick,
Yeah.
for people who are living alone. So,
It is an LQ, and I'm pilot. I've got a little pad behind me that I've been helping pilot. Yeah, if it's like LQ, it's you can make it a dog figure, you can make it a person, and that person they're getting up, walking by the counter, saying, "Good morning, Bob. How you doing today?" And then it goes into, have you taken your not only your medications? It's going to say, make sure you take these 3 pills. Dot dot dot. So that's part of the AI, and that's going to feed into. They can pull that information and feed it into your telehealth. So it's great. Companionship's huge. Going back to that, things that my clients are telling me that they're most worried about, and the largest group of folks at home are one person families. Maybe their spouse has passed away, or maybe in their community they've never had a relationship. It's the highest growing population as far as home care. It's also brought up the topic of loneliness, and you probably have read things about it. In America, loneliness is a very quickly it's a growing issue with folks, and as part of companionship. It was about 5 years ago. I'd already worked with a little help, which was Washington Park Cares, But I remember having this great epiphany at 60 that Rick, I need a little help. So I realized, I think it was the first time I said, eventually everybody's going to need a little help. So all these things, especially the companionship, I think that's going to be an issue. I talked to a family yesterday, and that was a big part of our caregiver coming in. Mom and dad are at their house alone. The kids are both working full-time 40-hour-a-week jobs. They're doing the best they can. But what they're most worried about with mom and dad, besides safety and eating, is having somebody there, just being.
Yeah. Well, and the lack of socialization is a major contributor to health issues. So yeah, we know that for
It
sure.
is. It does. It leads to, emotional health is important. And, I don't know, just having that spouse saying, I'm making dinner and let's go out and let's have conversations with friends, mentoring people. We need to stay active. And that's another thing I hear from my, when we go into a home, no one wants to lose their independence. So we want to come in helping them enhance their independence, companionship. And I hear a lot of my senior population, they want to be at peace. They want to continue having something purposeful in their lives. So again, we can all be part of that model and helping out.
Okay. Well, thank you so much, Rick. I don't see any other questions in the chat. Uh, so if nobody else has any questions, I think we can let Rick off the hook here.
Yeah. Well, it was an honor to see you all today and answer a few questions. And I'm very approachable. If you ever want to call Home Helpers Home Care here in Denver, you can get me on the phone. If you look the website up, it's got my cell phone. I'm very reachable, and uh, whatever your intent being on age wise, whether it's you're looking for information for your loved one or you're a supplier helping with services, I will say age wise. I'm very proud of Bob and Barbara and all of you guys. It's such a needed service and website. And I was just looking at it yesterday, and it's really neat to see all the people, Bob, that you've been able to bring together.
Thanks, Rick. Yeah, it's we enjoy doing it. We now have 1,300 and some service providers
54.
across the state.
That's
Yeah,
amazing. And it's
and
going to keep growing. You keep, you're expanding and it's growing. And,
yeah,
we are, Bob, we're kind of the new village movement, you and Barb, all of us.
yeah,
We're the village movement going AI.
yeah. Okay. Well, thanks again, everybody. I put Rick's Home Helpers Home Care profile from age wise in the chat, so you can find it there, and phone number and email and all that stuff. Andrea, you had a question?
Not a question, but I'd like to talk about the program I'm trying to create for Arapahoe County, not knowing what organizations all of these people work for. But if you're in Arapahoe County, Transportation Solutions Arapahoe County is trying to get a program up and running called Silver Society on the Go, which
Okay.
which will pick up shut-in seniors. So basically our criteria is Meals on Wheels. Pick up
Right.
shut-in seniors and deliver them to the nearest recreation center for socialization.
We very much appreciate it. This has been really great information for everyone, and we'll get this posted on our website in a few days too. So thank you.